My name is Dr. Juan Tejada, and I'm one of the advanced endoscopists here in Marietta Memorial System. And we recently converted fully to the use of the single-use duodenoscope. Because of some facilities, we have to be honest, we have a limited amount of scopes available. And if one is being cleaned and I'm using another one because I have several ERCPs, of course the patient is going to have to wait for a new scopes to come from the cleaning process or for one scope to be repaired. We don't have that problem anymore. Single use is the perfect setting. There's no worry about these things anymore because we have a brand new scope ready to be used. And if something happened during the procedure, we have a new scope. We have a brand new scope ready for it to be used. And the patient doesn't have to wait in anesthesia, and we don't have to wait any longer because we have it ready.